This presentation will discuss about the antagonist drugs, particularly the difference between the competitive and the non-competitive antagonists. So an antagonist drug is a drug that blocks the response produced by an agonist. It has affinity for the receptor but does not have intrinsic activity or efficacy. So therefore, it does not produce an effect. This diagram shows the comparison between the drug activity induced by a natural ligand, an agonist drug, and an antagonist drug. So what happens in the presence of a natural ligand? So a natural ligand will naturally bind to its receptor. When the ligand will bind to its receptor, it will produce an effect. And that effect is characteristic for that particular receptor. For example, when a particular ligand will bind to its receptor, for example, epinephrine will bind to the beta-1 receptor in the heart. So since the beta-1 receptor mediates the increase in the heart rate, so when epinephrine will bind to its receptor, so normally the activity of that particular receptor will be initiated. How about for an agonist drug? When an agonist drug will bind to its receptor, what will happen is it will mimic the action of that particular, the action of the ligand that binds normally to that particular receptor. So what will happen when an agonist will bind to its receptor? So it will just enhance the cellular activity of that particular receptor. So for example, when that particular receptor again will mediate increase in the uh, contraction of the heart, so the agonist drug will just mimic the natural action or the natural activity of that particular receptor. For the antagonist drug, so what does an antagonist drug do? It will block the agonist drug or the natural ligand from binding to its receptor. So when the antagonist drug will block the ligand, of course, the ligand will not be able to activate the receptor and it will not produce an effect. So yung antagonist drug, it will compete now for the natural ligand and the agonist drug from binding to its receptor, intended receptor, and the antagonist drug will block the agonist or the ligand from binding to its receptor, and it will produce no efficacy or no effect. It is important to note that most drugs used in therapeutics are receptor antagonists and prevent the action of natural agonists or natural ligands. So example of the natural ligands are the neurotransmitters, epinephrine or pinephrine, and the hormones. For example, estrogen, no? Insulin, and progesterone. There are many types of antagonism in pharmacology, but in this lecture, we are only going to focus on the competitive and the non-competitive. When we say competitive antagonist, this is an antagonist that competes for the same binding site with an agonist, and their binding is mutually exclusive. The competitive antagonist sits on the receptor, preventing the agonist from binding. And a characteristic of this antagonism is that the binding is completely reversible. So when we are going to increase now the concentration of the agonist can win the competition and it can overcome the competitive antagonist activity. This diagram shows the concentration response curve of an agonist in the presence of a competitive antagonist. And this exemplifies now the concept of the competitive antagonism. So some of the information that we can get out of this is the EC50 of the agonist effect alone and the agonist effect in the presence of the competitive antagonist. So as you can see here, one of the important feature of this diagram or this graph is the Emax or the maximum efficacy. So when we are going to administer an agonist together with a competitive antagonist, what happens to the Emax? So when we are going to compare that with the agonist alone, we can see that the Emax remains unchanged. How about the EC50? So the EC50 of the agonist together with the competitive antagonist is increased, meaning that the potency is reduced. So this implies that we need more drugs, or we need more of the agonist drug in order to overcome the effect of the competitive antagonist and still achieve the EC50. So for example, when our agonist is a natural ligand and we are going to administer, or we are going to take a competitive antagonist, what the body will do is it will increase the concentration of the agonist in order to overcome the effect of the competitive antagonist. Because of the characteristic of the agonist wherein the binding of the agonist to the receptor is completely reversible, meaning that the antagonist will be dissociated from its receptor when we are going to increase the amount of the agonist drug. So we can still achieve the maximum efficacy when we are going to increase the level of the agonist drug or the agonist ligand. So this implies that in clinical practice, to be able to overcome the effect of the competitive antagonist and still achieve the Emax of the agonist drug, the in the presence of the competitive antagonist, what should we do is we have to increase the dose of the agonist drug so that the agonist drug, the competitive antagonist drug, will be displaced from its receptor and the agonist drug will be able to bind to its receptor. So in summary, for a competitive antagonism, the Emax of an agonist drug will not be affected in the presence of a competitive antagonist, provided that we are going to increase the amount or the dose of our agonist drug. So the Emax will still be the same, but the potency will only be reduced. No? This is another diagram of the competitive inhibition showing what happens when we are going to administer an agonist together with a competitive antagonist. So in this case, of course, we have here now the x-axis represents the dose in nanogram per ml of the isoproterenol. Isoproterenol is actually a synthetic catechol compound and a potent beta-adrenergic agonist. So what does it do is it will induce peripheral vasodilation, bronchodilation, cardiac stimulating properties. That is a characteristic of the sympathetic stimulation. So it is an agonist. What it does, or what its effect is, increase in heart rate. So that is the effect of the agonist now. And we measure that through the Y scale, through this axis rather, through its percent effect in the heart rate. Percent increase in the heart rate. So this one here, the green line represents the effect of the isoproterenol. So increasing the dose of the isoproterenol will initiate these effects. And as you can see here, we have here the EC50, or the concentration of the drug that will achieve the 50% maximum effect. So this represents the potency of the drug. So the isoproterenol was able to achieve its maximum effect at this particular dose. So we also have here the dose response curve of isoproterenol in the presence of propanolol. Propanolol is considered to be a competitive antagonist. When we are going to administer propanolol together with the isoproterenol, what happens is the efficacy of the agonist drugs is unchanged. So the isoproterenol was able to achieve 100% efficacy, but the potency of the drug is reduced, meaning that more of the drug, more of the agonist drug is required in order to achieve EC50 and maximum efficacy. How about when we are going to double the dose of our propanolol, or we are going to double the dose of our uh, propanolol? So again, propanolol is an agonist, it is a beta blocker. So it will block the receptor of the isoproterenol, which is our agonist. So what happens when we are going to double the concentration of our competitive antagonist propanolol? So what happens is the curve further is shifted to the right, meaning that there is an increase in the dose of the drug, of the agonist drug isoproterenol, in order to achieve the same EC50 and the same amount of Emax. So the bottom line here is when we are going to administer a competitive antagonist in the body, not together with the agonist, the effect of the agonist would still be the same, provided that we are going to increase the dose of the drug, we are going to increase the dose of the agonist, so that we can overcome the effect of the competitive antagonist. Since the binding of the competitive antagonist to its receptor is reversible, increasing the dose of the agonist will overcome or will displace the antagonist from its receptor binding, and or so that now the agonist will be able to bind to its receptor and still achieve the maximum efficacy. We also have the non-competitive antagonist. So the non-competitive antagonist will either bind irreversibly through the covalent bond to the same site as the agonist, or bind to a different site, which reduces the binding of the agonist by allosteric mechanism. Inhibition cannot be overcome by increasing the concentration of the agonist. The primary effect of non-competitive antagonism is a reduction in the maximal effect produced by the agonist. So this type of drugs have a limited clinical use in therapeutics. What do we mean by allosteric inhibition? And what do we mean by an allosteric site? So allosteric site, or allosteric, means other site. So this is usually exemplified by enzymes through enzyme inhibition. So this diagram shows the enzymes together with its two receptor sites, the active site and the receptor site. The active site is where the substrate, or in the case of the receptor, it is where the ligand will naturally bind. And the other site, now it is where the antagonist or the receptor molecule will bind. So in this particular mechanism, the active site or the ligand binding site is different from that of the allosteric site. So in allosteric inhibition, the antagonist will normally fit into the allosteric site. That will later on change the conformation of this structure of this enzyme so that its substrate will not be able to bind to the enzyme. This is another representation of the allosteric inhibition of the enzyme that is usually similar to that of the receptor. This is the enzyme E, and it has two sites, the active site and the allosteric site. In this figure, the antagonist molecule is absent so that the substrate will be able to fit into the active site. So when in the presence of an allosteric antagonist or an inhibitor, what happens is, for example, when the antagonist molecule is present, it will bind to the allosteric site. After that, it will induce a conformational change to the receptor, changing the conformation or the structure of that particular enzyme. So when conformational change has happened, the substrate now cannot fit into the active site. So in this case, now the antagonist will serve just like an inhibitor. So this is also similar with that of the receptor. So for example, when a competitive antagonist, non-competitive antagonist is present, what it does is it can bind to the allosteric site of the receptor irreversibly, and it can also change the conformation of the receptor so that the ligand or the agonist will not be able to bind to its receptor. So again, this is an allosteric enzyme activity, showing the non-competitive inhibition. We have here the active enzyme, the active site, and the allosteric site. So a non-competitive inhibitor will bind to the allosteric site, and it will change the conformation of the enzyme so that the substrate will not be able to bind to its receptor. So this is still the same with the concept of the non-competitive inhibition in the receptor level. So a non-competitive inhibitor will bind to other site the other site of the receptor other than the ligand binding site. So it is considered to be a non-competitive in nature because the non-competitive antagonist will not compete with the agonist for its receptor site. What it only does is it will bind to the allosteric site, change the conformation of the receptor, and eventually leading to the ligand or to the agonist being unable not to bind to its receptor. This diagram shows the dose response curve of a non-competitive inhibition. Our agonist here is norepinephrine. Its dose is represented in the y-axis, in the x-axis in nanogram per ml. The y-axis represents the percent increase in the blood pressure, which is the effect of the norepinephrine at the level of the alpha adrenergic receptor. Our non-competitive antagonist here is the phenoxybenzaimine. It is a non-competitive antagonist. It will bind irreversibly to the alpha adrenergic receptors. Alpha adrenergic receptor is under the sympathetic nervous system, or it mediates the sympathetic activity of the body. So the line here, the black line here, represents the dose response curve of norepinephrine. When we are going to increase the concentration of the epinephrine, so it will achieve its EC50 at this level or at this dose, and Emax at this particular dose, particularly at a level of about 10 nanogram per ml. When we are going to administer phenoxybenzaimine, what will happen is the efficacy or the response of the norepinephrine will be reduced to about 50%. What will happen if we are going to double the concentration of our non-competitive antagonist? So the value of the efficacy of our norepinephrine will be further reduced, in this as shown in this particular diagram. So the bottom line here is for non-competitive antagonism, when we are going to administer a non-competitive antagonist, what it does is it will reduce the efficacy or the maximum response of our agonist. Even if we are going to increase the concentration of our agonist, it will not be able to win the competition. It will not be able to surmount the effect of our non-competitive antagonist because the binding between the non-competitive antagonist to the receptor where the agonist naturally binds is considered to be irreversible. We also have the mixed agonist-antagonist drug. So these refer to a drug which under some conditions behaves as an agonist, while under other conditions behaves as an antagonist. The best known agonist-antagonists are the opioids. So example of an opioid drug that is a mixed agonist-antagonist is butorphanol. Butorphanol is a partial agonist at the mu opioid receptor and a pure agonist at the kappa opioid receptor, and an antagonist activity at the delta opioid receptor. this in the previous presentation about the types of drugs based on the drug receptor interaction, we can say that affinity and efficacy are considered to be uncoupled, meaning that a compound can have great affinity but poor efficacy and vice versa. A compound can be an agonist for one receptor and an antagonist or inverse agonist for another receptor. This is true for the mixed agonist-antagonist drug. A full or partial agonist displays positive efficacy, while an antagonist displays zero efficacy or no effect. A full or partial inverse agonist displays a negative efficacy. So in terms of its chemical structure, usually the agonists have similar structure. Now, for example, this one here, this is an agonist drug. These are agonist drug, and it has similar structure with this agonist drug. So another is for the antagonist, they have little structural similarity. For example, pyridamine is structurally different from the other types of antagonist drugs. It is also important to note that all naturally occurring chemicals in the body are agonists. So these naturally occurring chemicals are also known as the endogenous ligands. Most antibiotics are antagonists. Again, when we say antibiotics, these are the drugs, the synthetic drugs that are produced outside the body. So most of them are considered to be antagonists. Drugs that bind to multiple receptors are said to produce many side effects because binding to different types of receptors will induce some side effects depending on the target organ that is bound by that particular drug.